Did a peer-reviewed study find that at least 217,000 Americans have died after receiving a COVID-19 vaccine? No, that's not true. A published study that suggested the total number of fatalities due to COVID-19 inoculation may be as high as 278,000 inches has been flagged by the journal's editorial board for making unsubstantiated claims and for possibly violating standards of peer review. The claim originated with a study published in the medical journal BMC Infectious Diseases on January 24, 2023, titled, "The Role of Social Circle COVID-19 Illness and Vaccination Experiences in COVID-19 Vaccination Decisions," an online survey of the United States population. This study has been used by some online users to further suggest, without corroboration, that COVID-19 vaccines have caused hundreds of thousands of deaths. One such example includes a newsletter posted to the self-publishing website Substack that was written by Steve Kirsch and published on January 25, 2023. Quote, "New peer-reviewed study. NGT. 217,000 Americans killed by the COVID vaccines in just the first year alone." End quote. Here is how the Substack post appeared at the time of this writing. Source: Substack screenshot taken Tuesday, January 31, 3:54. 002023 UTC. The findings in the study published in BMC, Kirsch argued, were entirely consistent with surveys he conducted. However, it is not clear which survey Kirsch is referring to. He did not include hyperlinks in his January 24 post, nor did he explain how he determined the 217,000 figure. As our newsroom reported in January 2023, Kirsch previously used a scientifically flawed measure of data to conduct such surveys. Quote, "Responses were not reported in a legitimate scientific journal, nor were they reviewed by scientific peers to determine the quality of the data and the veracity of the conclusions drawn. To be considered scientifically sound, researchers must be transparent with the data that they collect and study." Kirsch provided no further information about the responses he said he received, including how he controlled for external variables like lifestyle or previous health conditions, whether he vetted the claims made by respondents, the demographic data of the respondents, including age, ethnicity, race, sex and geographic location, or whether he verified that the death and cause of death reported were authentic. Additionally, the value of surveys using self-reported information from participants, especially a survey of readers of an anti-COVID vaccine blog like Kirsch's, is limited as a method of gathering public health statistics about Americans overall. End quote. It is not clear where Kirsch came up with the 217,000 figure or how it relates to the flagged study published in BMC. The BMC study flagged by journal publishers over legitimacy concerns at the time of this writing. The study published in BMC is under further editorial review after readers have raised concerns over the quality of the research. Below is an editor's note that appeared at the top of the study website. Quote, "The 26th of January 2023 editor's note. Readers are alerted that the conclusions of this paper are subject to criticisms that are being considered by editors. Specifically, that the claims are unsubstantiated and that there are questions about the quality of the peer review. A further editorial response will follow the resolution of these issues." End quote. Lead Stories contacted BMC for further specifications regarding the editorial review but did not receive a response. "We will update the article accordingly." Primary data was collected using the CDC VAERS system. The study published in BMC cited several limitations that are worth noting. First, the study author pulled information from the Centers for Disease Control and Prevention (CDC) Vaccine Adverse Event Reporting System (VAERS). It is not a measuring tool. It is an early warning system that monitors self-reported and physician-reported events involving patients using available vaccines, including the 4 approved or authorized for COVID-19. Anyone can report an adverse event to the VAERS system, and reports are not vetted by medical experts or professionals. A disclaimer from the CDC website notes, quote, "VAERS accepts and analyzes reports of possible health problems, also called adverse events, after vaccination. As an early warning system, VAERS cannot prove that a vaccine caused a problem. Specifically, A report to VAERS does not mean that a vaccine caused an adverse event. But VAERS can give CDC and FDA important information. If it looks as though a vaccine might be causing a problem, FDA and CDC will investigate further and take action if needed. Anyone can submit a report to VAERS, healthcare professionals, vaccine manufacturers, and the general public.